First, just to kind of talk about depression in general and some of the natural approaches to depression. My focus always starts with, from the nutrient side, looking at vitamin D levels, looking at B12, looking at folic acid levels, and looking at iron. Those are four nutrients whose deficiency state could lead to depressive symptoms. And there's enough evidence to show that replacing those nutrients or taking them in adequate amounts and in the right forms actually may improve mood. So that's always my first line look, and are those things going on? Let's start there before we consider herbs or medications to specifically treat depression. Another thing is the consideration of cognitive behavioral therapy. Lots of good studies on cognitive behavioral therapy, and it's gone against some of the traditional medications and shown that it's just as effective and actually has a longer standing effect once you stop both. So those would be certainly my first line things that I'd be thinking of, because those things are all safe in pregnancy, and certainly making sure you have adequate folic acid levels and vitamin D levels going into pregnancy is important for other reasons. The typical herbs that we talk about in depression would be St. John's wort. St. John's wort, you'd almost have to look at like an antidepressant. Its mechanism of action is very similar. As far as the antidepressants, they're sort of generally accepted as safe in pregnancy because the alternative is untreated depression, which is not good for pregnancy. Some of the antidepressants are, there may be higher levels of concerns with pregnancy, so I think it's, making sure you talk with, whoever is going to be your physician up throughout the pregnancy to get the latest in the updates and the evidence of which antidepressant, if needed, would be the best option. But again, first I would go with that nutrient look, consider cognitive behavioral therapy, and then have a discussion with whichever physician is going to be working with you on the least side effect concerning antidepressant if you feel like you still need that at the time.